in a few minutes. We'll be starting in a few minutes while people are still coming in. But in the meantime, if you want to enable your interpretation, you can do that already. For those who joined yesterday, you might already be familiar with this process, but for those who are joining us today for the first time, on the bottom of your screen, you should see a small globe icon that says interpretation. Either it'll be visible already, or if you click the circle with 3 dots for more, it should be there. If you click that, it'll show you 3 options: English, Spanish, and French. Please select whichever language you would prefer to hear the meeting in. Um, this meeting will mostly be in English. However, if you are still listening to English, we would like you to select English on the interpretation channels, because then if any of our participants or presenters speak in Spanish or French, you will hear the interpretation to English. So would request everyone to please update their interpretation channels to English or Spanish or French. Thank you. We will still give it a few more minutes before we start, but in the meantime, you can already start introducing yourself in the chat. Okay, I think we can begin almost on time, which I'm very happy about. So firstly, thank you to everyone for joining us today. Those who returned after yesterday, those who are here for the first time, a very good morning, afternoon, evening, wherever you're joining from. My name is Shannon. I use she, they pronouns, and I'm the communications officer of Shannon International, and I'm also your host for day 2 of the Knowledge Product Showcase. Firstly, just to ensure that everyone can access the live translation from their device. Yes, thank you. As it was yesterday, a majority of today will also be in English with continuous interpretation available in Spanish and French. To all the participants, we of course encourage you to speak in the language of your choice, and we will translate as you do that. In the meantime, to everyone who would like to perhaps listen to this meeting in another language, you can follow the instructions on the screen and set your interpretation channel. Even for those who are listening to today's meeting in English, I would encourage you to still change your interpretation channel to English so that if any of our presenters or participants speak another language, you can still understand them. And of course, you also have the option of muting the original audio, but you can also do that as and when you want. So I will give it a few more minutes while people choose their interpretation channels. But while we do that, and while everyone gets settled in, we can start introducing ourselves in the chat, which I see a lot of people have already started doing. You can do so by saying your name, pronouns, organization, country, and if you have the energy for it, maybe you can also answer this question as a small icebreaker, which is to share the best piece of advice you have ever been given about work or outside. So you can share some of your wisdom with the other participants. So again, please select your interpretation channels. Please introduce yourselves in the chat. There is also the option of enabling closed captions for the meeting. That is also available in the settings on Zoom with the title CC captions in English. I'm sorry, I don't know what it is in Spanish or French. So you can also select that. While most of the videos today have subtitles, you also have that option for to listen to us while we're talking. While we continue introducing ourselves, if we can go to the next slide, I can also quickly go over the program for today and maybe also get the housekeeping out of the way. So of course, we'll do the opening, which I already am. Then we'll have the welcome address by the coordinator, Shannon International, who you might already know. Then there's a slight change in the program that all of you might have already been seeing, is that we'll have a short quiz just to see how much everyone knows about the world of ShareNet knowledge products. Um, then we'll go into the round of knowledge product presentations, which is what all of you have come here for. The first round will be featuring 2 knowledge products from ShareNet Jordan and from ShareNet Ethiopia. Then, as we have done yesterday as well, we'll have a short chat activity where we ask for all of our attendees to share any recommendations for how the products they've seen can be used further in practice. Then we'll have a 10-minute break during which you can, of course, step away from the screen, but you can also get a bit of a overview of the presentations that happened yesterday in case you missed those. Then we'll go into the second round of knowledge products where we'll hear from from 2 presenters from ShareNet Netherlands and then from Malawi from ShareNet International. Then again, we do another Zoom chat activity. And then we close the meeting with another closing address. We thank you all and we're done for the day. And just for some general housekeeping rules, which I think all of you are already familiar with, but let's go over it anyway. We do request you to follow the format of name, pronouns, organization, country. So you can rename yourself on Zoom, of course, with that information. It helps us know who you are, and it also helps other attendees respond to you if need be. We encourage you to keep your video on if it's possible and to always keep your microphone off. The chat box is open to everyone, so you can leave your thoughts, questions, anything you would like to say throughout the course of the meeting. You can also raise your hand during the Q&A. We encourage you not to unmute yourself unless directly asked. And of course, please be respectful and considerate of everyone else. We are the field we work in. We talk about a lot of interesting topics, but also a lot of sensitive topics. And it is good to be considerate while talking to each other. And yes, I think with that, we can hopefully settle in and maybe hear someone else's voice after mine. So with that, I would like to invite my colleague Maria, who is the co-coordinator of ShareNet International. I'm sure a name and face all of you are familiar with, and she will address the gathering and kick off our program for today. So thank you, Maria. Over to you.
Yes, thank you, Shannon. And hi, everyone, again. I think some of you who were present there yesterday already know me, but for those who don't know me, I'm Maria Codina Lopez, and I'm the co-coordinator of Shannon International, and I did this together with my colleague Doreen, which I hope, if it's not around, she will be in a little bit. And today I'm also giving the opening words, or just saying a few words to kick off, but I just said it on behalf of our colleague from Shannon, Colombia, Carolina Peña, who unfortunately didn't feel well and couldn't be here. So yeah, these words are also on her behalf. As I said, welcome everyone again to the second edition of the Knowledge Products Showcase event 2024. We are really very happy to have you all here again. For those who were here yesterday, and for those who are just joining today, welcome to this edition. We are presenting throughout 2 days about 10 knowledge products. So as Shannon said, today we will hear about 4 of them, but yesterday we were very excited and we learned a lot about the 6 knowledge products that were presented. And as today they were a little bit from all over the globe. So we had products from Bangladesh, from Burundi, from Colombia, Ethiopia, and the Netherlands. And they presented a lot of different type of products. So for example, in Bangladesh, our members developed a period guide for parents to be able to support their daughters throughout their menstruation journey. We also heard about 2 board games on SRHR, one in Burundi, which was in Kirundi, and another one in Colombia, which was in Spanish, and that targeted the Caribbean youth in the country. And both of the games aimed at starting a conversation on SRHR and also at improving the decision-making of young people on SRHR, and especially the case in Burundi, to avoid teenage pregnancies. And after the break, we had 3 more presentations. One of them was the story of 2 girls, a short video developed by Ethiopian members of ShareNet, where they presented the story of 2 girls, one of them who could follow an education, and the other one who was pushed to be married, to get married, so that we could see how both their lives were going, and that the team in or the organizations in Ethiopia could use this video to create awareness and do advocacy on ending child marriage. And we also had a presentation of a research conducted in Burkina Faso about the SRHR needs of the LGBTQI+ community, the sex workers and the drug users in Burkina Faso, and how they did different dissemination events to spread what they found in this research. And then finally, from the Netherlands, there was a presentation of a graphic novel about endometriosis and gender diversity. So as you can see, there were a lot of different knowledge products that they really try to find contextualized solution to local challenges. And today we will have 4 more presentations, and they are also based on a lot of different topics. So we have policy brief from Cesarean section in the context of Jordan, and then we also have, for example, a mobile application for youth development developed in Ethiopia. And as I did yesterday, I wanted to take a moment to thank you all for participating, and also for the ones that were there yesterday. Thank you also for your active participation. We really hope that today it's the same. So please feel free to add your thoughts and your questions in the chat after each of the presentations, so that our colleagues that are here presenting can get back to you and we can have a discussion. So I will not wait any longer, and I think, Shannon, we are starting. I give it back to you while I share the screen.
Thank you so much, Maria, for Always, I think, setting the day up very well and getting everyone into the mood of learning more about SRHR from all of these different perspectives. And thank you for the quick recap of yesterday as well. I think it's, again, it's always very heartening to hear the kind of diverse knowledge products we have from all over the globe and how hard our members work to translate their research into something so important and usable. So before we go into the round of knowledge product presentations, some of you may have noticed, as I mentioned earlier, about the slight change in the program. And I would request everyone to go to menti.com and to type in the code you see on the screen, or to click on the link in the chat, or to even take out your phone and scan the QR code, because we'll do a small quiz. And I hope that doesn't scare anyone off, but in case it does, the winner of this quiz may get a small prize for how well they know. So let's give it maybe another minute before we start so we can see, we can let a few more people join in. We do encourage everyone to join in. Um, I won't say that there are no right answers because there very clearly are. But if you were paying attention today and yesterday, I think it should be easy for you. And if not, you'll walk away learning a bit more about our members and our network and what we do for knowledge translation. Okay, so then let's go to the next slide. Okay, so turn to your screen and yes, I think you should be able to see the question on your screen if you, yeah. And one second, sorry. I know it's not visible on the screen, so maybe I will read it out. The first question was, since what year has Shannon International awarded grants to support the creation of knowledge products? There are three options. And one second. Yes. Now we can go to the next question. Yes, if you are on your device, you'll see the next question is, when did Shannon launch its online SRHR knowledge products library? There'll be four options. I apologize for it not being visible on the screen right now, but if you are on the quiz, you will be seeing the questions and answers. So all the more reason for you to join in. And before we go to the next question, I'll also give you the answer. The question was, when did ShareNet launch its online SRHR knowledge products library? The options were 2022, 2023, 2024, and not launched yet. The correct answer was 2024. You can go to the next. Oh, I believe now you can see the questions on your screen. I see a question in the chat. Yes, perfect. Now, how many SRHR knowledge products do we have in our knowledge product library? You can take a wild guess. It's okay if it's not the exact answer. Okay, we see a lot of answers coming in. I see the majority of answers are right in the middle of 50 and 100, which is actually very close. We have exactly 82 knowledge products on our library. But fun fact, that isn't all of the knowledge products we have, as we are continuously adding more. But we can go to the next question. In the next question, we ask, which of sorry, apart from English, in which language do we have the most amount of knowledge products on our library? The options are Arabic, Bangla, French, and Spanish. Everyone put in their answers. And we can go to the next question, and I'll give you the answer to the previous one. So the previous, it's actually the language in which we have the most amount of knowledge products is Arabic, closely followed by Spanish, then Bangla, then French. And the next slide, we apologize for the technical difficulties in seeing it on the screen, but hopefully those who are on the quiz can see all of this. The question is, which of the following options are knowledge products? So we have training toolkits, board and card games, mobile applications, policy briefs, podcasts, research. And this one is an easy answer because all of these are knowledge products, because knowledge products can be anything that translate evidence and data into a usable product. And if you go to our knowledge product library, you'll actually see we have a lot more formats than the ones listed as answers. And now we can go to the next question. This might also be a bit easy, which is in what year did the first ShareNet knowledge product showcase take place? 2019, 2023, or 2024? Again, if you were paying attention just a bit, you should be able to answer this very easily. And the correct answer is, of course, 2023. Because this year is our second ever edition of the Knowledge Product Showcase. And we'll just do one more question, which is how many knowledge products were presented yesterday? If you were yesterday, you might remember, if you were here yesterday, you might remember. And if you were paying attention to Maria's opening address, she also mentioned it. And that answer is that there were 6 knowledge products presented yesterday, a few of which you will also see today during our break. And with that, we can close the quiz. Thank you to whoever participated. I can see there were some issues in joining and also issues in seeing it on the screen, but I commend the few people who stuck around regardless. And I hope that even if you weren't able to participate, you still learned a bit about the kind of knowledge products we have. And I hope you visit the Knowledge Product Library if you haven't already, and see a lot more about the knowledge products we have there in all the different languages and formats. With that, I think we can get back to what has brought all of you here. So the first round of knowledge product presentations will be from Shannon Jordan and from Shannon Ethiopia. And the first one, if you can go to the next screen, please. We have a policy brief, which is about reducing elective cesarean sections without medical justifications in Jordan. This has been put together by the team at Shannon Jordan, and it has been funded by Shannon Jordan's annual activities. And now we will watch the presentation.
Ladies and gentlemen, I am Dr. Dalal Aburrab, member of Shannon Jordan, and today I will be addressing a pressing issue that is impacting maternal health care in Jordan, the increase of elective cesarean section without medical justification. Current situation. Jordan is currently experiencing a concerning increase in elective cesarean section, mirroring a global trend where cesarean rates have increased significantly over the year. The cesarean section rate in Jordan has surged to 25.8% in recent years, posing health risk for both mother and children, while also straining healthcare resources due to higher costs compared to vaginal delivery. The problem statement is the increase in elective cesarean section without medical justification presents several challenges, including increased health risk for both mother and babies, longer recovery time, and financial strain on healthcare system. Studies indicate that this trend, is left unchecked, could lead to long-term health issues for mother and increased healthcare costs. Recent data from Jordan shows that cesarean rate has increased to 42.8%, with significant percentage being elective procedures. The World Health Organization has issued warning about the risk associated with excessive cesarean section, leading the Ministry of Health in Jordan to collaborate with international organizations to develop guidelines aimed at promoting vaginal deliveries and reducing unnecessary cesarean section. Our analysis utilizing the Ishikawa chart has identified 5 main domains contributing to the increase in elective cesarean section, including inadequate service delivery setting, misconceptions among beneficiaries and their families, biases within healthcare practices, and gap in policies and enforcement, and financial incentives for cesarean section. The policy alternative to address these challenges were proposed for key policy alternatives. First one, empowering women and raising awareness by educating women about the benefit of vaginal delivery and the risk of unnecessary cesarean section. We aim to empower them to make informed choices about their delivery method. Second, mandating adherence to guidelines, implementing policies that enforce adherence to national guidelines and clinical peer review can help ensure that healthcare providers prioritize evidence-based practices. Third one, enhancing financial incentives. By incentivizing a healthcare provider to prioritize vaginal deliveries and revisiting prices structure, we can promote shift toward safer and more cost-effective delivery method. The last one, mitigation discomfort with pain relief. By providing access to pain relief measures such as epidural anesthesia can help address concern about the pain associated with vaginal delivery and reduce preference for cesarean section. In conclusion, addressing the issue of elective cesarean section without medical justification in Jordan required a comprehensive approach that combined these policies alternatives. To effectively implement these strategies, a national committee comprising key stakeholders should be established to oversee and ensure the success of these policies in reducing unnecessary cesarean section. We urge a policymaker and healthcare professional, community leaders, and advocacy group to come together and collaborate in implementing these policies recommendations. It's crucial that we work collectively to advocate for maternal health, empower women with informed decision-making, and ensure the well-being of both mothers and newborn.
Thank you so much to Dr. Dalal and to Shannon Jordan for putting together this policy brief and putting together this presentation. I would now like to invite all of our attendees to share any thoughts or ask any questions in the chat. And while you do that, I'd like to invite Dr. Dalal to join us in answering some questions.
Hello, everyone. I am here
Hello,
to
Dr.
answer
Dalal.
your question. Hello, how are you?
Thank you for the lovely presentation and also for joining us. I think while we wait for our attendees to ask questions, I had a question for you and the team. I was wondering, how did you identify this issue to work on? Is this something that you saw in your own work, or because you said in the presentation it said that the rates are increasing globally, but what made you and your team decide that this was something that needed urgent action?
Thank you for this good question. And I want to just describe this for you and all the attendees that in Jordan, this issue is raised since around more than a long period of time. And for example, maybe more than 3 to 4 years ago. And the researcher started study this issue. And we depend on this policy brief on the recent studies conducted in Jordan. And those studies highlight the increased rate in the unjustified cesarean section in Jordan. And also, we have a registry for the hospital for all maternal يعني intervention and activity in Jordan. And when they review the maternity procedure conducted during the last years, the researcher found that there's increase in the number of unjustified cesarean section. Because of that, the High Population Council do this study in collaboration with the ShareNet Jordan in order to raise the issue and ask the decision maker to intervene and to have another phase of management in order to decrease this phenomenon.
Okay, thank you so much. And so, of course, you mentioned that Higher Population Council and Shannon Jordan was the team that worked on it. But I think in your presentation, you mentioned that there were also other important stakeholders who were involved. Who were some of the stakeholders that you had involved in developing this policy brief?
The Ministry of Health, you know that the umbrella of all health sector in Jordan is the Ministry of Health, and also all the participant in the health sector in Jordan, such as the Royal Medical Services, because in Jordan, the Royal Medical Services, they have their facilities that provide the maternal health services. And also we have two big academian hospitals in Jordan also provide maternity services. Also, they participated in this policy brief. In addition to the funded organization like USAID, they also have a lot of participation to improve the maternal health in Jordan. Also, they were part in this policy brief.
Okay, thank you.
And other entity also like WHO and all entity participated to have any work with the maternal health in Jordan. Also, yeah, I forget that the private hospital, which is the most important part in the health sector in Jordan, the private hospital, also they are participated in this policy brief.
Okay, that's really great to hear. I already see some questions in the chat, which I'll direct to you. First, we have a question. How do you try to reconcile the increasing number without medical justification versus the principle of client choice? So um, is the lack of medical justification puts a lot of the responsibility on the service provider, but are there also clients or patients who opt for having cesarean, and how do you find the balance between that in this study?
You know that there's a lot of study. It's not only one study. Some of the studies that focusing on the client preference, because some of the women, they prefer to go for cesarean section. That's related to the fear of the pain and the fear of the talk that she hear from her relatives or their friends related to the pain associated with the normal delivery. And because of that, they are going to ask their physician, and not only they ask, they urge their physician to go for a cesarean section according to their preferences. Other reason that investigated in this study, that the physician who are going to make the second cesarean section delivery based on the first cesarean section, it's part of their fear of liability and fear of يعني risk associated with the second normal delivery after the first one with cesarean section. So there's a lot of reason has been investigated in this study, and after that we conclude the result behind requesting the unrationalized cesarean section.
Okay, thank you so much. I see you've, I think, already answered one of the questions. I also, looking at the time, I think we'll take one more question. And Dr. Dalal, if you want to stay on and answer the rest of the questions in the chat, of course, we welcome you to. I guess the question is, what is the result, if any? Have cesarean operations reduced since this has been flagged as an issue?
You know, as I mentioned in the presentation, that we investigate the reason of unrationalized cesarean section, and we highlight and focus on certain alternatives, and after that we recommend for the policymaker in order to do those solution or those prioritized intervention. So now currently we are in the phase of raising the issue and putting the recommendation, asking the decision maker in order to take action based on this recommendation.
Okay. Thank you so much. Again, there are a lot more interesting questions in the chat. Dr. Dalal, anyone from the HPC or Shannon Jordan team, if you'd like to answer, or if there are from other countries or organizations, if you also work in this field and have your stories to share, anything to add, please do so in the chat. Thank you so much, Dr. Dalal, for this very, very enlightening presentation and for answering our questions. Thank you.
Thank you. You are welcome. Bye-bye.
Bye. With that, I will also move to our next knowledge product. If we could share the screen. Thank you so much. From Shannon, Ethiopia, we have the Eshet Children and Youth Development Organization, which will talk a bit about a mobile application they've developed called Adoye. And they were the recipients of last year's ShareNet International Knowledge Activation Grants. So with that, let's watch their video.
Hello everyone, I'm Dr. of Technology Solutions. Today I'm here to present you Adoye, a joint product that was developed between Eshet Youth and Children Development Organization and Orbit Technology Solutions. Adoye was created to provide safe and supportive space for girls in our community. We understand the challenge that girls often faces, and we believe it's crucial to empower them and ensure their safety. Girls in our society encounter various obstacles, including sexual harassment, child marriage, lack of access to education, and awareness about their rights. These challenges can be a profound impact on their life and well-being. So Adoye offers several key features dedicated to address these issues. If you want to access Adoye, you can get it from Google Play Store. I will show you the steps to download the app. At first, you should open Play Store application on your device. After that, select the search icon in the search bar at the top. Type Adoye. Then click the search icon. After that, select the Adoye platform from the search result list. Then click on the install button. After downloading Adoye platform, we will open it. As you can see on the screen, when you open the app for the first time, we will redirect to comforting page. This page will come to me provide you a brief overview of the service. On this page, there is a button that says start. We will click on it. And it will redirect to this page.
Thank you for that video presentation to the ECYDO and Orbit Technologies. Now, of course, we open up to our audiences any questions you have about this application, and perhaps questions to the creators. While you do that, I do invite, I believe, Bethel from ECYDO to join me. Bethel, if you are here.
Yes, I'm here. Hello, everyone.
Hello. I am just looking for you. Yes. Okay, I think I can hear you clearly, if you can also hear me.
Yeah, I can hear you.
Okay, firstly, thank you so much for joining us today, and also to you and your team for developing this app. I think from the video, we can all see that it's not only just a very important app, but a very well-made app. While we wait for our attendees to kind of ask their questions, I also see a lot of congratulations coming for you already. I do want to ask, I see that this application is in Amharic.
Amharic.
Amharic, sorry. When was this app launched? Has it been around for a while? Has it been used by a lot of people already?
This app is recently developed and it's in language of both Amharic and English. And we are working on also to be in the language of Armenia since it's the second most spoken language in Ethiopia. And it was a recently project.
Okay. And I think we saw in the video that it offers a lot of services, and we saw also helpline numbers. Could you tell us a bit more about the kind of services a user can access on this app?
Okay, the users can access different features. The resource feature is the one section that provide a collection of resources that can help users in their personal and professional lives. It includes educational material, health information, and career advice. The other feature is community insight. We provide insights and analytics about the community activities and interactions. There are also shortcuts, which offer quick access to essential services and information for users to access instead of going or navigating through the whole app. We have a safe space section, which provide a secure environment where girls can seek support, report abuse and gender-based violences, and find resource for their safety and well-being. Since the launch of this app, the Adoye platform is all about empowering girls, providing safe space for them to report gender-based violence or other abuses. We provide a safe space so they can report and they can experience share with other girls too. There's also an admin panel feature in which we can manage, we can collect data, and we respond to users' inquiries and support requests. Overall, this app is all about empowering girls, protecting them so they can feel and report any violences and abuses. It's particularly made for adolescent girls.
Okay, specifically. And because you said that there's also a service where you can see what kind of community events are happening. Is this all across Ethiopia, or is this in specific parts of the country?
Currently, we begin only in Adama zone, but we are planning to upscale it all over Ethiopia. We're working on it, but currently it's in Adama zone practically.
Okay. Well, if we have other attendees from Ethiopia who also want to contribute, I guess you know who to get in touch with. Um, Again, for the attendees, if you have questions about this app, please do. Because you mentioned that, of course, you're expanding the app, you're translating it into another language. Have you also received interest from other countries or other locations, or maybe even from other parts of the population who want the app to be, targeted to other populations apart from just young women?
Like I said earlier, the app just launched.
Yeah.
So currently, we are only particularly focused on adolescent girls, but we plan to scale up all over Ethiopia. And based on the reports, once everybody or all over the world can participate in this app, uh, we have this admin feature. So based on the insight we received, we can include others too.
Okay. And I know you said that it's very recently launched, but and I think this question is also being asked in the chat. Is that firstly, congratulations, and that they know that some INGOs and local NGOs have developed somewhat similar applications. What would you say are the features unique to your app? And if you have received feedback, what kind of feedback have you gotten?
So we have different features, unique features. One of the things is we facilitate access to service. We create opportunity for girls to connect with essential services, particularly those in need of gender-based violence and sexual abuses. This service encompass social, psychological, legal, and other forms of support. They can access all these different kind of services within one app, within Adoye platform app. And also we empower them by recognizing and celebrating their unique strength, talents, and achievement. Like I said, creating a safe space is also one big achievement. They can feel secure and supportive environment where girls can connect and share experience. And the other thing is we provide essential resources. We deliver access to vital tools, service, and information that aid in personal growth, educational growth, and overall well-being. So we provide essential resources. I think this features difference us.
Thank you for sharing that. I think it's also great that you've created a community space on the app. I was also wondering, have you faced any challenges while developing the app, or maybe challenges after you release the app?
Yeah, once we developed the app, it took us more time than we expected to upload it on Google Play after Adobe, after it was developed. It took us more time than we expected to upload it on Google Play. That was one of our challenge.
Okay. And I see another question in the chat. What about girls or women's access to quality services on abortion? Does the application provide information or services around abortion or access to abortion?
This app collectively provides resources or services, including hospitals, police stations, and other informations. The community news, we include that too. So basically, they can get any information they got, whether it's abortion or SRH right. Yes, we work on both gender-based violences and SRH health. So they get their information or services about sexual related health. So abortion, I think, includes in that too.
Okay, that's also great to hear. Thank you. I think we're also maybe have time for one more question, or if Ethel, you'd like to share anything about what the process of creating this app was, or maybe if you want to share anything about what you hope this app can achieve.
Yeah, okay.
We'll have a few minutes.
Okay. We hope for instance, now it's only on Google App. So in the future, we are planning to develop it on also other stores like Apple Store. So we're working on that. Like I said earlier, we're working on scaling it up all over Ethiopia. and making it available to all the girls all over the Ethiopia, including in the rural and urban areas. And uh, we want to thank our partners for making this app possible, like ShareNet International and Orbit Technology Solutions, and which without our partners, this app won't be possible. So we'd like to give a big thanks to those partners. So thank you.
No, thank you. And again, like everyone else in the chat has also said, a lot of congratulations to you and your team. This really sounds like it was quite a huge effort, and we're really happy that the app is not only launched but receiving very good, a very positive response. And if you or someone from your team maybe leave your email ID or some contact information, I'm sure there are other attendees and members from Ethiopia who would want to know more, and maybe perhaps even support in the expansion. So please, yeah. And
Sure, will do.
yes, thank you so much, Betul. Thank you for coming on board. I see there are more questions for you and your team coming in the chat. Please feel free to answer them in the chat themselves. But unfortunately, I will have to end this segment right now. Thank you again, Betul, and thank you to the ECYDO and the Orbit team for this app. And with that, we come to the end of the first round of our knowledge products. I would just like to give a virtual and physical applause to both our presenters and both their teams. As we always do after the rounds of presentations, of course, we are learning a lot about the knowledge products, but we also want to know how these products can be put further into practice. So we do ask all of our attendees, all of our participants, maybe even the presenters, to share any ideas or any recommendations they have on how this product can be used, not only in the context for which they were created, but maybe even outside. If you have ideas for support, collaboration, about how this product can be distributed more, if you know, if you yourself are doing work on this topic, if you have any advice, this is your time to write it down in the chat and share it with all of us. We have about 10 minutes for this activity, so you can think and write. And if some interesting results come in, then I'll also share that. But you have a few minutes to think and write it down. I hope everyone is thinking hard, and that's why we're not getting anything in. But of course, you can keep adding to it later on as well. And just because I got a message about this, I thought I would share it with everyone, that the presentations that you have already seen about the knowledge products and the ones you will see, all of these will be made available on the ShareNet International YouTube channel. And the knowledge products, if they are already made and ready to be made public, you can either find them on the knowledge products website, on ShareNet International, or you can also see them on the websites of the different country hubs. I think in some cases, some of our presenters have already put in links to where you can find the knowledge product. So don't worry, even after this meeting, all of this information will still be available. Okay, we have 1 more minute for the from the Zoom chat activity, but I can see some points already streaming in. So we have someone who said that the knowledge products can be used if other organizations can also leverage on this and extend the usage by creating a hub for people to be mentored. I think that's an excellent point and already um, feeds into the kind of work that I think all of these create, all of the members and what the network is already doing. Uh, so of course, these knowledge products will be made available, and of course, you can always get in touch with the organizations who have made them to figure out how to collaborate. Of course, we always encourage more spaces to collaborate and support each other in scaling up, which has been a lot of interest. Um, I also see a question that this is an amazing endeavor, but there's a suggestion that small research studies should be done in every country about the topics and results and share on this group for future works. Um, so again, an excellent point. I think the communities of practice that we have, the international communities of practice at the international network level, but of course the communities of practice in the hubs are also great spaces to work on specific topics within the SRHR umbrella. Okay, now I see a lot of questions are coming in, so clearly everyone was thinking very hard, but I don't think we have time to really address all of them on screen. But please engage with each other in the chat. Um, we are now 1 hour into this meeting, so I think that's a good time for a break. And we are also right on schedule, so I'm very happy and thank you to everyone else for also being very mindful participants. So we do have a 10-minute break. So right now, Netherlands time is 4 p.m., which means that at 4:10, we'll be back from our break. But in the meantime, we'll also play some videos that will give you a bit of information about the presentations from yesterday. But yes, the break has begun. Please return in 10 minutes. Thank you.
Hello, everyone. I'm Dr. Maddalena Giacomozzi. My pronouns are they, them. I'm a clinical sexologist, and I am also the president and co-founder of the Treaty Queer Foundation. I'm here today to talk to you about It's a Journey, which is a product that talks about endometriosis among trans and gender diverse people. And it's a very exciting product because it's a graphic medicine novel. So you can both read a story, look at the pictures, and get more information about endometriosis and gender diversity through the innovative tool of graphic medicine.
Hello everyone, I'm here with Molla from Shannon, Ethiopia. We developed an animation video about child marriage and teenage pregnancy. The animation video portrays a life of two girls, one who goes to school and the other forced to marriage. So it shows the comparison of the two girls' life. So we invite you to share this animation video to reach a wider audience. Thank you.
Hello, my name is Shannon. I'm the founder of Ritu Health and Wellbeing Foundation based in Dhaka, Bangladesh. With the help of ShareNet International, we developed a guide for dads. The title was Be Your Daughter's Superhero. So in our patriarchal society, period is considered as taboo. Daughters and girls in their adolescence period, they are not encouraged to talk about their pubertal journeys, menstrual needs, and their growing ups. So to inspire the dads and fathers and in the broader sense to inspire the male to talk about the period and puberty, we developed this guide. We already have used the real father-daughters in this book to demonstrate the real relationships they have. Our vision is to build a gender-neutral period narratives in Bangladesh and in the world. So this book is playing a great role to inspire the male generation, young male, to talk about puberty and women's spiritual issues. So we have already implemented this book in field. More than 100 fathers are using this book right now who have adolescent daughters, and they have reported very significant and impactful positive stories. So our vision is to take this book to the other countries. So we invite all of you to take this book if possible and use the contents in your own language to inspire more men to use period narratives in their own languages and to change the world for our girls and women. Thank you for listening to me.
We are ECYDO Foundation, an organization that promotes sexual and reproductive rights through ethnic and territorial approach. Using traditional games from the Pacific region, we create engaging, cultural, relevant educational experiences. We also promote gender-based violence prevention, among other initiatives focusing on environmental and territorial issues. We work with children, adolescents, youth, and women. So let's join us and be part of our initiatives. We believe that education is the tool for mobility. And you?
Hello, everyone. I hope everyone was able to make use of their break. And I would like to invite everyone to slowly start coming back to their devices, and we'll resume in another minute. Okay, hello again, everyone. I hope everyone has slowly made their way back. I see some cameras pointing at empty walls, but hopefully you can still hear my voice haunting you in your room and you come back. Okay, I guess with that, we can start with our second round of knowledge products today, also the final round. So we hope we still have your energy and attention with us. So we have two more knowledge products left from AFU International from the Netherlands and from the Community Forum in Malawi. First, we'll have AFU. Yes, if you can go to the next screen. Yes, and they'll be talking about their Bridging the Gaps project, which is about effective sex treatment response for the LGBTQI+ communities who are affected by problematic chemsex and what can be done towards their good sexual health. They were a recipient of the Shannon International Knowledge Activation Grant last year, and we are very excited to see what they've been working on.
Chemsex is a social-cultural phenomenon and a global health concern because some results show a strong association with the HIV transmission, with STIs transmission. There are several theories that explain and kind of fit the chemsex, and one of these concepts and theories is the minority stress theory. Minority stress theory proposed three processes through which stressors affect health behavior and outcomes, and there are environmental stressors, distal stressors, such as discrimination and violence, and proximal, such as internalized negative attitudes about minority status, sexuality, or gender identity. A combination of these stressors can cause the chronic high level of stress among GBMSM and trans individuals, and could lead to emotional dysregulation, increased vulnerability to HIV, and potentially substance use disorders. Clients and patients never come to us saying, I have minority stress. People usually come with very specific things, such as expressing things like, I'm not normal, I'm damaged, people like me should not live, and so on and so forth. This is how minority stress results on the individual's levels and how people process these things. Not every illicit drug can be used for chemsex. A classical triad for chemsex, such as methadone or meal, GHB, GBL or G, and TINA or crystal methamphetamine. When talking about chemsex in Eastern Europe, Central Asia, I put specifically crystal amphetamine as a smaller picture to say that in our countries, crystal methamphetamine is not prevalent, almost not prevalent. So our chemsex users mostly use methadone, which is the main substance, and GHB. So first of all, we wanted to understand experiences of GB-MSM in 3 targeted countries who practice chemsex. We adapted qualitative methodology. We recruited and trained 3 national data collectors, so for 1 person in each country, who conducted the interviews with chemsex users, with healthcare or service providers. We conducted a workshop where we trained them how the basics of qualitative research. We trained them how to conduct interviews, how to avoid potential pitfalls during the data collection, and we trained them to use the interview guide for our study, and ask them to practice, to show, to make sure that the data collected on a certain level and ensure the high quality of our material. And overall, we collected 28 interviews with chemsex users and 9 interviews with service providers. And we experienced a lot of issues, such as building the trust with the potential participants. But because our recruiters were from the communities, I think we managed to successfully recruit people to this study.
The main drugs that they use for chemsex practices are methadone, MDMA, butyrate, and amphetamine. And 3 respondents reported injecting drug use for chemsex. Frequency of participation in chemsex sessions varied from every day to once every few months. And 4 respondents reported that they had intentionally stopped using drugs for sex, and the abstinence period ranged from 1 month to 3 years. As for the service providers, and they represent both medical specialists working in government healthcare organization and employees of non-profit, non-governmental organization. As for the risk reduction practices among MSM, respondents use a fairly diverse set of practices before, during, and after chemsex sessions. The majority of respondents try to plan chemsex sessions to avoid interference with their professional obligations. And for this reason, some men limited their chemsex engagement to the weekends in order to have sufficient time to recover physically and mentally. During the chemsex session, men usually take PrEP, and also they try to independently control the doses of drugs they take, just to avoid overdose or mix of drugs. As for the respondents who inject drugs, they mentioned that they prefer to be injected by someone who has more knowledge and experience. Respondents tried to look out for each other by providing information about doses, effects of substances, and overdose prevention, as well as care in case of health emergencies and withdrawal symptoms. However, it's very important to mention there is a strong reluctance to call emergency services in life-threatening situations due to possible legal consequences. As for reducing harm after unprotected sex, respondents take HIV post-exposure prophylaxis, get tested for STIs and HIV. Those are giving yourself enough time to rest is also important, as well as to eat and drink a lot. The first reason is a person's failure to recognize that he has a problem, and the majority of respondents note that MSM involved in the practice of chemsex usually don't understand the risks of using drugs, or they underestimate the impact on the body. There is also a high level of homophobia and drug phobia in society in these 3 countries, and MSM who practice chemsex usually suffer from double stigmatization. the large majority of respondents mentioned the importance of reliable information. Most respondents admitted they don't know how to assist someone in case of an overdose. The respondents emphasize the importance of non-judgmental support. It's necessary to create safe spaces where people can talk openly about him-sex experiences with peers and professionals. Respondents working in government medical organizations mentioned a lack of knowledge of the specifics of counseling, especially MSM. Service providers also need regional data on him-sex, information about distribution, about him-sex patterns. There is a lack of information in organizations, including those related to the regional contexts, since most of the studies were conducted in Western countries, may not be relevant for the countries in Eastern Europe and Central Asia. The management component includes the need to develop protocols and recommendations for the management, treatment, and assistance to people who use psychoactive substances in sexual contexts. All respondents noted the lack of working documents, protocols, guidelines, recommendations on the provision of medical and psychological assistance to people who use psychoactive substances in the context of sex in all these three countries. Most MSM do not understand the double addiction, addiction from drugs and addiction from sex under drugs. And the first priority for people involved in him-sex is to reduce the risk of drug use and get professional and effective help for drug addiction treatment.
Thank you so much to the AFU team for this presentation, and also I think a topic that I think a lot of us don't often hear about, but is clearly needs a far more nuanced look than we're all familiar with. So thank you so much for this research. Again, I'd like to ask all of our attendees to share any thoughts, any questions they have in the chat. And while you do that, I would like to invite Ekaterina to join me to answer these questions.
Thank you, Shannon. Hello, and thanks for your feedback. It is indeed a very under-researched and also under-talked about issue, especially when it comes to the region that we work on, Eastern Europe and Central Asia, because men who have sex with men, LGBT, those groups are unfortunately marginalized and in some countries even criminalized. So to refer to the question about the legal situation, that of course in the context of the region is very unfriendly towards chemsex users and GB MSM community. So which is why it is also an under-researched topic. Just yesterday, after a third hearing in Georgia, a very a package of censorious homophobic laws was passed, which is kind of an example of how things have been getting increasingly more difficult for this community that is already hard to reach because they are facing double stigma and double discrimination because of their sexual orientation, but also for using drugs and engaging in chemsex. Which is why one of the most important recommendations of the study is to provide more informational research, more trustable information, and also having more anonymous channels for help. and for connecting people.
Right. Thank you so much. Because I also saw in your presentation, of course, there was a recommendation of, exchanging best practices amongst medical professionals and other stakeholders in this space. Through the course of your research, have you already heard ideas of, have you already heard some best practices, especially in, navigating the legality of the identity of the patient as well as the legality of the drugs involved? Are there some best practices you already know or have come across? Yeah.
Yes, of course, there are several best practices that our researchers in the 3 eco countries, Kyrgyzstan, Georgia, and Ukraine, have thoroughly researched and proposed, and these will be included in our guide, which will extract the recommendations and main findings from the research and will be available shortly in both English and Russian. I can also send more information in the chat later. But yes, because it is a very sensitive issue in the region, a lot of the best practices have been borrowed from abroad. Like there are several very good practices regarding chemsex in the UK, for example. So, of course, it will depend how they will be contextualized and to what extent they can be adapted to the regional context. But yes, and also I'm interesting to read in the comments that indeed chemsex is not a very common research topic. I see also in other countries, not in other regions, not only Eastern Europe and Central Asia. So good to have this conversation.
Actually, I'm glad you mentioned that because I think there are also just a few more questions about if you could just explain chemsex again. Just to all the attendees.
Of course, it's a relatively new term, and it doesn't even translate to several languages even, but it is basically the act of engaging in sexual activity while being under drugs. And there are several types of drugs, as mentioned by our researchers in the presentation, that are among the most popular ones that people who engage in chemsex use. And that's mostly methadone in the eco region, but it can vary. So it's basically yes, being under the influence of psychoactive substances while engaging in sexual activity. And this phenomenon is not only a public health concern, but also social concern, because it is very hard, as you can imagine, to regulate the safety of these events, of these sessions, as respondents in our research have called them. So it has been incredibly valuable for us to get even to collect a glimpse of data of self-help practices and group help practices that are being used to mitigate any possible risks and complications.
Thank you. I'm also sorry, like I think all of us want to know so much more about this, but also keeping a track of time. I think maybe we can instead of taking one more question, perhaps if you have any final thoughts to share about having worked on this project, something that maybe something we wouldn't have thought of, or something that was new information for you as well as you were doing this research.
Thank you, and thank you for also providing this space for talking about these issues. It's really, it's nice to have this safe space to talk about it. Unlike there being no safe space, for example, to talk about it in our target countries. But yes, for us, it has been eye-opening to see how innovative actually some of the self-help practices and approaches to help each other have been among the men who have sex with men who engage in chemsex. For example, there has been an example from Kyrgyzstan where this particular respondent knew that there could be negative effects from the drugs during the chemsex sessions in form of being very thirsty. So they would prepare a lot of liquids beforehand, or as it has been mentioned during the presentation, if the chemsex session involved injectable drugs, then people would turn to a person with more experience. So the process would be safer than if it had been done by someone less experienced. So it was very very interesting to read all these kinds of examples and how people still try to help each other, help themselves, even though a majority of them do not recognize this being an issue. They do not mostly recognize that they're affected by addiction, or they think that it is just a recurring thing they do, like and that it is not a real concern, which in this information can also help service providers and industry professionals to know how to approach people when they hear and recognize that, oh, this issue is concerning chemsex.
Yeah. No, thank you. Thank you so much. I think I speak for everyone here when I say how enlightening this presentation has been. And I think also that you situated it in the minority stress theory. I think that is something that all of us can definitely see in our own work across so many different issues. And the fact that even in your presentation, it's about risk mitigation as well, that it's, before, during, and even after. And it's not, I think there's a lot of realism in the kind of recommendations you've made. So how realistic it is. So yes, thank you so much for being here and answering our questions. To everyone else in the chat, I think, thank you for also passing along your praise and interest to Codina. I hope I'm saying your name right.
Yes.
Yes. Okay. And the ACU team, and the video presentation will be made available on our YouTube channel. And of course, she's also left her contact information in case you want to ask more questions. So yes, thank you so much. And we look forward to seeing more about your work.
Thanks very much for having me.
Thank you.
Bye.
Yes, okay. So really happy with the engagement. Let's keep that energy going for our last presenter of the day, which is from the Community Forum from Malawi, who's a part of the Shannon International Network. They were also one of the grant recipients of the Knowledge Activation Grant last year from Shannon International. And they are here to talk about the In Real Life project using a digital platform. And unfortunately, due to technical issues, we weren't able to have their recorded presentation today, but I do believe Joshua from the Community Forum is here to talk live about their knowledge product and their journey. Joshua, are you here right now?
Okay, thank you so much. I'm sorry I've just joined the meeting late because I was attending another meeting. So I'm sorry for that. And as well, I'm sorry because of the technical issues. I was supposed to share the video showing everything that we have done during the implementation of the project. Unfortunately, my laptop is here. This is the laptop that has left me lazy. So so I lost most of the information because of some of the technical issues. So let me just quick present a few things about the project, in a real life project funded by ShareNet International in 2023. The ShareNet International, of course, has granted 10,000 euros, which has made us to implement the project in real life from 2023, 2024, where we were able to have some sessions and even doing or developing some tools that we shared, and we have some of them in place. For youth, especially concerning sexual reproductive health rights among the young people. So through this project, of course, I've just seen great impact on the ground because more youth, we are able to know their rights to access SRH services. And even the flyers, the booklet that we developed, more youth are able to use in their youth clubs to share some experiences on how they can be able to prevent from, for example, sexual reproductive health rights, especially STIs, sexually transmitted infections. They are able to know the procedures on how they can prevent in their own, and where as well they can get the health services because it's well explained, and even young journalists we are trained where they will be able to support the project in sharing more information concerning SRH information and where they can get information, and they were able as well to interview the health practitioners on how youth can be interacted for them to know their rights to SRH, including the prevention of HIV and AIDS. And on the same, because of the ShareNet International project that have been implemented last year and this year, earlier this year, some funders were able even to be interested to pump in other resources towards SRH and HIV prevention. For example, PEPFAR has funded us $10,000 in December after seeing the impact of ShareNet International project of digital awareness project. So we are implemented, I can say like that, because the project is facing this month, which we are able to use digital platforms to mobilize and engage young people on how they can be able to know their rights as well. It's similar with the ShareNet, but the difference is the PEPFAR project, we are able to give the credit to young people so that they can be able to voice out through their social platforms. For example, Facebook, Twitter, Instagram, LinkedIn, TikTok. So we are able to give the data so that they can reach to more young people because of the data that we are giving them. And on the same, the government through the district health office, they are able to work collaboratively with us in the community by delivering health information and provision of health services, whereby even without us, the health officials, they are able to go to the ground and they share the information on SRH and HIV prevention. And on the same, they have formed some youth clubs within the communities because of the information that they are able to gain through, for example, this booklet. The young people, they are able to share in their own. Even if we are not there, they are able to train each other. And on the same, as I already said, through this ShareNet International, which is a digital program, we have partnered with Sustain for Life, where they have managed to give us almost $15,000 to promote digital projects in Malawi. And in this project, we have given up one of the school where we have procured 15 computers and installation of internet as a internet cave or internet lab, where young people can be there to access more information concerning SRH. And on the same, we are targeting special needs children for them to access more information on how they can be self-sustained in getting more information on their daily lives. So some of the impact of this ShareNet International project that GOF received in 2023, we have seen more impact on the ground, and even the youth themselves, as I already said, even they are able even to come to us, sharing with us more skills, more information on how they are impacting because of the ShareNet funding. So in short, this is what we have done because of the ShareNet International project. So I really appreciate, because by then it was like a small project, but for us it is not a small project, because has bear other fruits which were not expected because of the digital and other projects or other donors. They are able to interest to fund other digital projects to call for because of the ShareNet project. Thank you so much.
Thank you so much, Joshua. I'm almost, I mean, I hope your laptop gets better, but I think it's better that we got to hear you speak like this, but I think it was very, very inspiring.
Thank you.
And I disagree with you calling it a small project. I think what you've done, what you and your team have done, is you've really approached it from so many different angles, where you've done a lot of, I guess, community work. You've created resources. You are capacitating young people and training them to take ownership. And I think, yeah, I think this you've done a lot with this project. I'll give our audience members a few more minutes if you want to drop any questions in the chat for Joshua about this project, about their work, what they've been doing, where they're going to go. I think I see a question already, which is about sharing this information on SRHR. The resources, the document that we were looking at that you've made, is this something that is available to other organizations as well? Joshua, you are on mute. Yeah.
Yes, thank you. Of course, I will share the document because what we need is to see the impact on the ground. If the information are shared and if the youth are able to get the information that is helping for them, it's very good. So I'll share the document. I think after the conversation, I'll share with you.
Okay, great. And you mentioned that you have received a lot of interest, a lot of support from donors as well to expand this project. Could you tell us a bit more about what more we can expect to hear and see about this project?
Yeah, yeah, of course, as I already said, after implementing the ShareNet International, which is a digital project, the PEPFAR has funded us with $10,000, which we started in 2023 December, and is phasing up this month end September. So they were more interested to see local organization involving the youth to be more available, more interested as well to share information concerning SRH, and as well the issues that are affecting the youth. So it's when they said, oh, this is a good project, so let us intervene, let us support where we can. So they gave us $10,000. And this year, of course, they were here 2 weeks ago to evaluate and see whether they can continue supporting us. So we drafted another proposal, and it seems like they are going to fund us as well for 2024, 2025 in the same digital program where we want to see more young people interacting, because in this one, we are not only targeting the area that we are implementing physically, but we are able to even to reach to more areas, sometime in Lirongo, which is almost 300, 400 kilometers from where we are, because of the digital platform that we are using. Whereby, and on the same, since we are providing the bundle, the bundle is an issue in Malawi. Internet is very expensive for young people to access. So we are providing the data with the bundle to the youth. So they are able, when we are giving them the data on a monthly basis, they are able to share some experience in their own, and as well engaging other partners to say that ACOF is doing this. We need more organizations to intervene to help us to get more information. So, and on the same, when I applied to Sustain for Life, and when we say, oh, we are already piloted this project in digital platform, so we need as well to reach to more people and as well to train to more young people in digital technology. Is when they gave us 15,000 US dollars to buy 15 computers for young people to have an access to internet, and on the same to install internet for these 15 computers to be connected. So this is how more partners they are interested to engage us, to partner with us because of the digital that we are using. And no other organizations, especially in Chukwa where we are, they are doing similar like what we are doing.
I think I can already see someone who is interested in collaborating with you. So clearly, I think there's a lot of interest in also supporting you and expanding the network. I also see one question in the chat for you, which is that this product helps helps adolescents who don't know about their future aim, or does it also help them develop their future aims?
Can you come again, please?
Yes. I think they're asking that is this product only for people who know what they want to do in the future, or will it also help people who might not know, or young people who don't know what to do with their future, and will it give them guidance?
Yeah, of course, we are working in both in and out of school youth, which means those who are in school, they know their future. But those who are out of school, they don't know much about their future. So we work in both sides to ensure that they should know their, for example, they should know their rights. For example, in Chihuahua, currently the government is implementing a project, what we call Green Belt, where they want to promote food security through irrigation. So we have more people coming from different areas, different districts, different countries to implement that project. So through that project, Chikwawa now is prone to more diseases, for example, STIs. So through this digital platform, we are able to reach to more young people, and the health officials, they are able as well to talk more, because we as well give the credit or the bundle to the health practitioners so that they can talk on the issue for health. So we are working in both, to those who know their future and to those who doesn't know their future.
Okay, thank you so much. I think that I have so many more questions for you, and I'm sure everyone else does as well. But just to keep track of time, I think we'll close it here. Thank you so much, Joshua, for coming and giving a live presentation and sharing all the wonderful work you've been doing. To our other attendees, if you still have questions for Joshua about this project, please feel free to leave them in the chat. And Joshua, if you have time to answer them, great. Otherwise, maybe you can also share your email or your organization's email, where people who are interested in knowing more or collaborating.
I think I'll drop my email and my
Perfect.
WhatsApp number in this chat.
Perfect. Whatever you're comfortable sharing, that would be great.
Thank you so much.
Thank you so much, Joshua.
Thank you.
Okay, on that very positive, inspiring note, we come to the close of our knowledge product presentations. And firstly, I think just a round of applause to all of our presenters, to the organizations they're representing, the knowledge products they've created, and of course, also all of our attendees who have been very, very observant and have been asking a lot of very great questions, pertinent questions, thought-provoking questions. So just round of applause to everyone involved. Unfortunately, I still have one more task for you, which is something that we have been doing at the end of all of our rounds of presentations, which is a short 5-minute Zoom chat activity where we ask you to share any ideas, any recommendations you have on how the knowledge products you've seen so far can be put into practice. So you can share any ideas you have about the two products we just saw, which is about effective chemsex response from AFU, and now from Joshua from the Community Forum about the in real life digital platform. And of course, if you still have questions specifically for the presenters, for the organizations who've created these knowledge products, please feel free to drop them in the chat. And hopefully they can respond to it now, or we will share them. We'll share your questions with them. So just take a few minutes to think about how these products can be maybe developed further, or how they could be adapted to different contexts. If you or your organization already do work on this topic and you'd like to collaborate, you'd like to support, we are open to all your ideas. So I'll just give you a few more minutes to think about that. I apologize for interrupting if you're deep in thought, but just because I'm looking at the time, I ideally would have wanted to give you all a few more minutes to note down your thoughts in silence, but I also don't want us to run over the time we had set for today's meeting. So of course, please keep writing in the chat. I can already answer one question, which is to share the knowledge products from all the participants. So like I said, we will be sharing all of the video presentations from yesterday and today on our YouTube channel, which you will receive in a follow-up email. And of course, all of the knowledge products from this year and going back 10 years are also available on the Knowledge Products Library on the ShareNet International website. And if you were here for the quiz earlier, you would know that there are already 82 knowledge products on that library. So with that, I will slowly move towards wrapping up this session. And with that, I would like to invite Maria again to please deliver our closing address. Over to you, Maria.
Yes, thank you, Shannon. And hi, everyone, again. Thank you very much for those who stayed until the end. I think we were between like 45 and 55 people today participating in this event. And yesterday we were about 90 people. So thank you very much to everyone who made the time to be here. And I hope you enjoyed these events as much as I did. And also that we all learn new things, which I think we did, as we saw in the chat. And it's also very nice to see how some of you see the use of these knowledge products also in your context. So I would also encourage you to please continue link to each other and see how the knowledge products can be contextualized. I think for ShareNet, knowledge translation is at the core of what we do, and that we do believe that with these products that all of you have developed, we can find solutions to local challenges, and that we can improve policy and practice on sexual and reproductive health and rights. So yeah, again, as Shannon already said, congratulations to everyone who presented, and also all the other knowledge products that have not been able to be presented here, but that you will be able to find in the knowledge product library that I think has been shared before in the chat. And there you can also download the products and contact the people who did the products, so that you can see how it can be adapted to your context. As I mentioned yesterday, this is quite a crucial moment or year for ShareNet, as the future is a little bit uncertain due to political changes worldwide, but especially here in the Netherlands. However, I think we would like to thank the Dutch Ministry of Foreign Affairs for supporting the knowledge platform for more than 10 years now. And yeah, we say 10 years because we're also celebrating the 10th anniversary of ShareNet International. We know we started developing or setting up the international platform back in 2012, 2013, but it was not until 2014 that the ShareNet International and the hubs in Burundi, Bangladesh, Jordan, and the Netherlands were up and running. And this year we have been celebrating everything that we all have achieved in different ways. So, for example, some of the hubs have been having national activities. We also celebrated during our annual members meeting. And of course, we also want to celebrate by sharing all the knowledge products in this event. This celebration moment is also giving us some space to reflect on what we have done, and also to find the most impactful stories. So that's why we would like to invite you to share with ShareNet International how the platform has impacted or supported your work on advancing sexual and reproductive health and rights in different contexts. So please don't hesitate to contact me or some other people in the team like Shannon or Ami. If you want to share your experience with ShareNet or how the platform has helped your work, because I think this can really help us show the added value of a platform like ShareNet International. And also we would like to take a minute to thank all of our members and also all of you that are here because of the amazing job that you do through the ShareNet platform. And to be honest, without all of you, this platform would not exist. So thank you very much. And even if the future is a bit uncertain, we hope to keep working towards advancing SRHR policy and practice, and ensuring that everyone can choose about their sexuality, their reproductive health, and that everyone's rights are ensured. And we want to continue doing this with all of you. So I really loved when I saw that some of you are already trying to collaborate together. And then finally, also big thank you to the organizing team, to Al, Ami, and Shannon especially, and also Razan, who gave the closing words yesterday. I think it has been another very successful 2 days event. And also thank you to everyone who presented the work today. So I think this is all from our side, and let's keep getting inspired and work together. Back to you, Shannon.
And to add to all the thanks you gave, thank you to you as well for opening the gathering yesterday, and then opening and closing it today, and stepping in for Carolina from Colombia, who unfortunately couldn't be here. So yes, I don't think there are any extra thanks I need to give. Maria was very, very comprehensive, as always. And since we are just 1 minute before time, I won't leave you just yet. Of course, it wouldn't be a ShareNet event if we didn't obsessively ask you for your thoughts on things. So if we could just ask you to maybe once more join a Menti. And this is just for you to share what your takeaways were from yesterday and today. It could be from specific products, from specific conversations, the overall event. Yeah, we'd love to know what you learned and what you're walking away with. And you can do that by either scanning the QR code on your screen with your phone. I believe on the top of the screen, there should be menti.com and a code visible. And I think there should also be a link in the chat. So please do leave your thoughts, leave as many thoughts as you want. And yes, now we are 1 minute beyond time, so you are no longer held hostage in this meeting. You may resume your other activities and keep contributing to this Menti. And yes, with that, I think we can call this a successful close to the meeting. And thank you again to everyone who was here and participated and hopefully learned from it as much as we did. So thank you to everyone and have a great rest of the day and week. And we hope to see you soon at another ShareNet event. And if you're not a member, please become a member. The future might be confusing and not clear, but we will still be around. And your support is what keeps us going. So thank you, everyone. Yeah, claps for everyone. And we will be in touch after the meeting to get feedback and also share the presentations from today. And in the follow-up, we'll be asking for, what your feedback and your evaluation of this event was, just so we also know how to make it better next time around. We will be closing the meeting shortly. So you are not being kicked out. It's just the meeting's ended. Hello.
Hi, Shannon.
I think the interpreters have
There's
left.
gone. Is that tight? Everyone is tight. I think.
That's fine.
Yeah, it's fine.
Okay.
No, I don't. Congratulations.
Congratulations.
Yeah,
Oh,
thank you. This was very nice.
yes.
Yeah.
Yeah. Yeah,
And
I
you
think
know, I realized while Joshua was presenting, I was like, oh, let me look at the folder, the knowledge product. Maybe I can find something to share. And when I shared it, I looked into the final narrative report, and there a nice video of 3 minutes.
Oh,
On
shit.
YouTube, that's the one I throw in the chat. That was like the
Okay.
perfect video, but I don't know why he didn't recall us that.
I think maybe he didn't know that it was, maybe he didn't know we had it.
Yes, but
Uh,
he had the final narrative. It's in the report, and I did not thought about it. It was like just he had to send one.
No, so what happened is when I realized that Joshua isn't there, I was just like, okay, oh my God, any chance it's on the knowledge product library? And then it was. So then I was ready that okay, if Joshua doesn't come, we're just gonna say there was some issue, and I was just gonna start talking from the knowledge product
I was
library.
looking. I was already looking in the folder because I thought maybe there is because what they do generally, all this video they make about their project, they add the link in the final narrative report. So I was like already looking. So if it does show up, we can just throw this video and share it.
Okay, but maybe we can already share that with Joshua in case he's panicking that he doesn't have any of the videos from his laptop crashing.
It's all the link from Facebook they did and the YouTube video is there. I saw it in the chat. So I was like, why he didn't tell us? He forgot maybe.
Yeah,
But
sounds
it's okay, he
stressful.
did well.
It's fine. Yeah,
It
I
was
think it
nice.
was still good. Yeah.
Yeah, it was very nice. Yeah. Great.
Okay.
So next step, are you sending the evaluation today?
No, well, I wanted to ask, is the evaluation only in English or is it in Spanish and French as well?
Oh, it's only in English. That's a good question.
Because I think from the feedback we received from the hubs, we need to have it in Spanish and French as well.
And French. Oh, let's see.
So I know on SurveyMonkey it gives you the option of selecting language, but I don't know if we need to maybe, yeah, I
Because
don't know if you want to
what
ask.
Camilo did is he just shared the link and I only see in English. Well, let's see if there is an option other language. Let's check.
Yeah.
Mm.
Because I made the email.
That's a good point.
I made the email and I scheduled it, and then suddenly I went back and I was like, oh shit, we can't send it just in English.
That's
So
yeah, but I think
forgot to
there
ask
was the option. I think we used to share in different languages.
Yeah.
Let's see.
But no, then I also I won't be able to do it today because I also need to translate the email into Spanish and English. So that I'll do tomorrow because
I can see an option is, but it used to have an option.
Okay, then maybe
let
email
me-
Camilo. Yeah,
Yeah.
just ask him that in the
Ask him,
past.
yeah.
Yeah, let
Yeah.
him do it. Let him figure it out.
Yeah, it used to have this option. I don't know why I can see it here. Oh, did we have you stopped the recording? Oh, we stopped talking. Oh my goodness.